Tuesday, and welcome back to another episode of MSL Lead Chronicles, where leaders learn from leaders. I'm Mary Morton, and along with my buddy Chad Fellers, we have casual talk about the challenges and successes in medical affairs with the most exciting and impactful professionals in pharma. As always, we have another great one for you today, so stick around.
Hello, and welcome back to another episode of MSL Lead Chronicles, where leaders learn from leaders. I'm your host, Chad Fellers, and I have along my... Nope, I don't. My nifty sidekick, Mary, is out of the country with her daughter, celebrating her upcoming birthday. So if you are a friend of Mary, make sure you send her a shout out, send her a message over the coming week or so. I won't give her actual birth date away, but it is end of January birthday, and I miss my buddy, but I know she's enjoying her time with her daughter. So shout out to Mary, and I'm going to try to help do and drive this solo. So here we go. So you may see the face that's already on screen with me again. We actually had Dr. Tanisha Hill back in 2025, talking about digital, her role in digital healthcare. And in our conversation, one of the things we were talking about were health equity. And that's one of the ventures that she has been partnering on for several years. And she's actually the founder of Digital Health for Equitable Health Alliance, which is a nonprofit focused on making healthcare more accessible for underserved communities. If you did not hear our first conversation with her, it was titled Strategic Leadership in the Digital Health Era with Tanisha Hill, and I believe it was episode 47. So definitely check that out on your favorite pod listening resource. But without further ado, welcome back, Dr. Tanisha Hill, one of my favorite friends over the years. How are you?
I'm good today. How are you? Thanks for having me back.
I am good. I mean, you always put a smile on my face. I think about all of our times at congresses and shoe selections and what type of chocolate we're going to be eating. Or I always knew to sit beside you because it was always going to be some type of fun adventure, or at least my stomach was going to be full one way or another. So I know we're going to have a great conversation today. Let's just re-anchor, right? I know that we wanted to have you back on. I know that Mary wanted to be a part of it, but we couldn't wait any longer. So before we dive in, let's just re-anchor, right? So can you remind our listeners about just briefly your journey in pharma at a high level, and then what inspired you to lead DHEH?
Yeah, so I started in the clinical setting a very, very long time ago. So I won't say when because I'd be dating the gray hair.
It's our little secret.
Right, the gray hair already speaks for itself. Yes, I started a long time ago, and I ended up working. I think what really propelled me was working in the clinical setting in respiratory, in pediatric pulmonology in Atlanta. And it was the largest, probably still is the largest pediatric pulmonology practice in the country. And so folks sort of wanted to do research, right? Especially since we're in Atlanta, very diverse population. And especially if you want to do research with people, I don't like to say people of color because we're all different colors at the end of the day, right? So especially if you need to do research with people who are part of underserved or marginalized populations, we were like a great place for that kind of work to be done. So that's really, I think, what started. And then I realized that there was a pharma role and pharmaceutical role like an MSL. And I was like, oh, that's really cool. I want to do that. I worked with a doctor who was able to refer me to, where you and I ended up working together. And from there, I started as an MSL, led MSL teams, became a medical director, led medical directors, led multiple teams, started digital in the digital space because we were launching digital inhalers. So for folks who are familiar inhalers, you're probably like, what are you talking about? We essentially added a battery and a motherboard, and we're able to actually collect let's say I call digital biomarkers, so you can tell how fast they were inhaling, when they were inhaling, as well as if they use their inhalers at all. So that was very cool. It really set me
Mm.
in this path. And to level set, I went to, because I was digital, right, with these inhalers, I started getting into the digital health space and started going to conferences that were really focused on digital health. I sat on a panel many moons ago at one conference and ran into this really fantastic conference called Health, HLTH. And when I went there were about 4,000 people, I think, when I got there, or maybe less, but it was still smaller than it is today. And 80% of the conversation was around health equity. And then they had
Mm.
these amazing new technologies. And it included companies like Walmart and Walgreens and Microsoft and Pharma and, IDNs of the world. And I was like, look at all these people doing these great things with technology and healthcare. And so I made sure I went every year thereafter. And then I noticed that there was a lot of tools, there were a lot of interventions, tons of passion, people really trying to do the right thing, but it would not have been sustainable. I noticed that there was a um, lack of sustainability by way of policy. So, and I could hear that, right? You could hear the
Yeah.
gaps, and like, well, we don't have any policies for whatever. And then I thought, you know what? COVID came, the George Floyd era, and my way of contributing, again, being in Atlanta where everybody was either protesting or I
Hmm.
just wasn't in that space where I could do that. And I really wanted something that would have an impact across the nation and started Digital Health for Equitable Health Alliance. And the my leaders at the pharma company helped me sort of get it going. And within the first 4 months of us launching, we had 15 member organizations.
Wow.
We had we have representation. It's very unique. We have representation from pharma, biotech, tech companies.
Okay.
We have all four historically Black college and university medical institutions with representation. We have community based organizations. We have physician advocacy. It's fantastic. And what we do is we scan the air, and we had, so I do need to try to raise money at this point. It's a different era. So maybe we'll
Yeah.
get to that. Right.
Let's
Equity
do.
Equity is not
Yeah.
even a word right anymore. So we'll
Yeah.
get we'll get to that. I'm a little challenged now with the organization that the mission is still there, the vision is still there, but we need to raise funding to continue to do what we do. We had a company, um, advocacy group. They were really a team of lawyers that really helped us. So they would scan the airways. They'd bring us in front of legislators and staffers of
Mm.
legislators, and we kept our finger on the pulse of the intersection between digital health and health equity, but also a little bit about health equity in general. So if we saw a bill or something being considered and it wasn't equitable, we would send our comments. We had gotten to the place within 1 year where we were really interfacing with our legislators in general. We were interfacing even with CMS, the
Wow.
FDA. Folks had questions. We were becoming sort of the one stop shop to understand, okay, how will what we're doing impact from an
Hmm.
equity perspective? How will it impact marginalized populations? So I'll give you a clear example. I think you're going to ask me this. I'm going to jump the gun. A clear example, with the telehealth affordabilities and expanded telehealth with COVID.
Hmm.
Year over year, there's discussions about, do we keep this going or not? Do we pay, and how much are we going to lose and how much are we going to gain? And are people really using it? And the last question was, are physicians double dipping, which I thought was absolutely absurd. But these are things that people think about, right? Especially when it comes to the overall budget, because the healthcare budget in the United States is exorbitant. And so I understand why you would ask these types of questions, or I would understand the need to ask questions. I don't know
Yes.
about those
Yes.
questions specifically, but so anyway, we were able to talk directly about considerations when it comes to expanding telehealth. And one of the things that happened is that they removed the audio only, the audio piece of it. So if I am my, 90-year-old mother and, or anyone in a marginalized population who's also in an elderly or aged
Yeah.
population, and I can't get on this two-way interface like me and you, but my doctor still needs to call me back, the doctor's not going to get paid, right? Or if the doctor calls instead of this two-way interface, which is very hard for people to do, he or she will not get reimbursed. And reimbursement is key because you got to pay people to answer the
Yeah.
phone. So they're
Yeah.
not in it to make thousands of dollars, but they did. They came and asked us, what do you think? And we were like, wow, this is demonstration of our presence and our impact as an
Mm.
organization. Um, and the fact that there was so many different walks of life. Like we had one physician from Harry, she was like completely passionate, and it was just a wonder. We had Black Women's Health Imperative, for example, the African American Wellness Project, and even the American Cancer Society,
Wow.
the Action Network is part of the organization. So it was huge.
But what do you know, in traditional fashion here at MSLE Chronicles, key takeaways, any key takeaways that you have regarding either DHEH itself, health equity, what are in general, pharma's perspective and how they could potentially support? I'll leave it open for you, but any thoughts on that?
So key takeaways is that everyone can play a role. But
Yeah.
so that's the first one. And then the second one is that equity doesn't always mean um, race or ethnicity, right? There are people who are biased against or have disabilities in cognition. There are people who are visually impaired or hearing impaired. So I want folks to walk away. And when you think about health equity, what we advocate for is not just that if you look different by way of race and ethnicity or if you're in a marginalized population, that's not just it, right? We want to make sure that everyone, regardless of who you are, has access to care.
Okay, so let's get into the core of this. So you talked a little bit about how you define health equity, and a little bit what it means in practical terms for patients, providers, and for pharma. Let's get into the why, right? How does inequity in healthcare impact clinical trials, patient outcomes, and then even access to therapies? Let's go into a little more detail of what you were starting to about that.
Yeah, so in a number of ways, right? So I mentioned that health equity is not just race or ethnicity. So let's keep remembering that because if you have a therapeutic or a tool, right, that you as a pharma company or biotech company and that you've developed and that's your key area of focus, it may be, in an effort to help people who are visually impaired, right? It may
Yep.
not just be race or ethnicity. So just with that in context, your clinical trials should be as equitable as possible, right? Because you don't know how these therapies or tools will actually work in the real world.
Yeah.
And you and I have been in pharma for a long time now, and I've also ran clinical trials for pharma before coming to pharma. So I've been in this space for over 20 years. Oftentimes, the protocols get developed in isolation.
Mm.
Sometimes, more often than not, actually, even in isolation and exclusion of the physicians who are treating those patients, right? It's oftentimes the physicians within the company. And so you may lose sight of the real world impact of your drug or your tool that you're developing. And so you lose sight of, we're often gunning for efficacy, but we may lose sight about whether or not it's actually efficacious. So if it's not efficacious, if you say to me, okay, this drug works in this population and we've seen that it's made this impact, but I can't either get access to it or my genetics alone, because I'm from African ancestry, metabolize my your drug differently,
Yeah.
whole population that's not going to get access. And so, from a health perspective, that's a huge deficit. If you're in the business of doing business, there's also a huge deficit if your company can't generate or serve the masses, right? You're not gonna make the bottom line, then you can't do more research and you can't get more MSLs. It's a cycle. So it's really important to make sure from an overall business perspective, business in the business of doing well for health and for people, but also business in the business of doing business, that you make sure that whatever you do can touch as many people as possible.
So that's really interesting. Because I'm trying to think about the both sides of, or I wouldn't say pros and cons necessarily, but the potential consequences. And obviously insurance is one of those things that comes to mind with right. I mean, can they pigeonhole, if it's not stratified appropriately or any of those types of things? Could that ultimately impact the business from that aspect? I think from a human standpoint, and it definitely is something that needs to be considered and prioritized whenever possible. I think being strategic in how things are set up in ways. I guess my question for you is, even from the medical director lens, as we're thinking about clinical trials, how has this, or just kind of your learning from your time in this area, folks in this area, how has that impacted, or have you seen it impact where that's been brought in as part of the conversation for a phase 2-3 trial or phase 3 versus just a real world, phase 4, to see like what from the real world perspective, how has this been integrated in a proactive type of fashion, or have you even seen that? Is that just what we're working to achieve down the road, or have you seen cases where that's now being considered?
Yeah, definitely now being considered. Still room for growth when we think about down the road. DHEH, the Digital Health for Equitable Health Alliance, actually did comment on the FDA's, guidance around clinical trial diversity. And the organization was a big supporter of manufacturers now having to come up with clinical trial diversity plans, right? There's still gaps there. There's no
Yeah.
framework for a diversity plan, for example. There's not a lot of standardization in terms of requirements or consistencies or anything like that. But it's a huge start because
Yeah.
manufacturers are now having to consider this, no matter whether or not they have an actual clinical trial diversity plan yet in place. It has to be considered. I think that that's a huge step, and we're here today. That's where we are today for sure. And so we will soon, hopefully, start to see more evolution of broader representation in clinical trials. There was a study that, you and I were in respiratory for a while. There was a study that was done by someone who's pretty prominent in respiratory, but he's a public health person in general. And it really demonstrated that only 2% of people are really represented in clinical trials. So there's like 98% of people who aren't represented in most of the
Yeah.
clinical and some of that is not the fault of industry or not the fault of any individual. You have to really design your trials where if you really just want to get clear-cut understanding of the true efficacy
Yeah.
and causality, if you're looking at causality, did X actually cause Y? You have to you tend to try to narrow your study where you're not putting in all these outliers or confounders, right? Things to make your study sort of messy. And so, with that said, you oftentimes knock out smokers, you knock out people over a certain age and under a certain age. And,
Yeah.
kids, you don't want to try new drugs on them until we know how things are going. So, it narrows the scope in general, just a standard way of doing clinical trials. But that doesn't mean we can't do better. So, what I've seen, real quick, is I've seen industry doing really well across the board about partnering with organizations or companies to help increase clinical trial diversity, going to academic institutions or places like where I used to work, that's in Atlanta, or the population of people who are in underserved populations is greater. So I've seen a lot of that in addition to them really trying to figure out this clinical trial diversity plan.
I have seen attempts to really try to expand, um, to um, to expand really the pool, if you will, for clinical trials. I think often there's also hesitation in many communities to want to be a part of those, and so it's trying to think how do we get So I don't know if it's necessarily reflective of industry targeting a certain population as much as I think it's a mixture of a lot of different things. I think there are ways to improve it. Like one of the things that came to mind is how do we think about going beyond just our typical PIs and really supporting those maybe that have a large underserved community as a provider there, and providing them with the tools to facilitate and be a part of clinical trials because they have the trust of their patients, right? Versus going to a place that maybe not have that. So that's just one thing that came to mind. But my question for you is like, what are the biggest challenges you see organizations facing when trying to implement health equity strategies?
Yeah, I think that's a tough question. Oh, goodness. So let me just start with clinical trials, and then I'll talk
Yeah.
about organizations. Since you mentioned the clinical, because you bring up a very good point. Trust is huge, right? Regardless of clinical trials or not. Communities that are underserved or have historically negative experiences with the healthcare industry in general, it's really tough to get the buy-in, clinical trial or not, even with new therapies. Like, give you an example. Took my mom to GI. They offered her these really great samples for her tummy, and she's like, "I'm not gonna be a guinea pig when we get in the car." And she throws them in the back of the car. Right? They're like, "Your stomach hurts." Like, what? And it's free. Yeah, no, she's not trying it. She literally was like, "Nope, I'm not doing it," and it went flying in the back of the car. So to your point, there is a trust factor that I think is probably going to be the biggest challenge. And whether or not it's a clinical trial, adoption of a new therapy, meaning maybe not even new to the world, maybe new to that patient, is often a challenge. There's also cultural challenges, right? So that people don't often recognize. They think because I'm Black, that everybody else is, who's Black, we all think and do the same thing and act the same way. I don't know. I'll share a quick story. And when you and I first started, and I was out in the field, I used to see this doctor. He and I are really close now. Love him. A white male. And I walk in, and a second or third visit, he's, "Tanisha, why do all Black people want to go to Africa?" And I'm like, "Well, I haven't been trying to buy a ticket, so I don't like." But it's an assumption, right? So, which is unfortunate. We are all from different walks of life. Our DNA is all different. We all culturally are different. Like African Americans from the Caribbean, like my family, we think and eat and work differently than African Americans from the South, where my husband is. And so I think we have to walk away from, the hardest part is trust, but also having an understanding of how not to pigeonhole, how not to stereotype, how to be respectful of differences, period, right? I think that's where one of the things that a lot of people in this space and I are working on right now is how to move away from the term equity, right? I know once we had a change in administration, it pushed us to think that way. But I think about just differences in general. It's okay to have differences. And one of the great things about the younger generation is, the folks who are really connected on the internet is that they connect with people across the world. And so differences aren't that foreign anymore, and they're not that different, right? They're not that scary. So hopefully organizations can get to a place where we start thinking differently about equity. We're just thinking about people have differences of opinion, people have different cultures, we look, we sound, we metabolize drugs differently. We just need to go with that mindset as pharma, as individuals, as biotech, whomever we are. We need to just go with that mindset that, one, we're all patients at the end of the day. It's funny when I sit in meetings and in pharma, and we're all like in biotech, and we're all like, well, the patients. We're all patients.
Yeah.
And I think we forget that, and we're all different. So to me, that's just the biggest takeaway is just recognizing, there's a little challenge with trust, and that we're all different, and differences are okay. And we need to respect and try to understand them as much as we can.
A rather large heterogeneous population, right? It is that, that's such a good asking questions versus assuming things too, as well, is kind of what I hear out of that.
All of our DNA is different, regardless of,
right.
I think about DNA just on a bigger picture too, like not just by way of, genetics, but also culturally. That's in our
Yeah.
DNA. You know, we eat certain foods. That's in our DNA. And so we're all different. And I think that
Yeah.
that's what we need to recognize.
Good word. Keep preaching. That's great.
Free.
It's so true. So all right, moving along here, I'm thinking about practical terms. I'm a medical affairs leader listening today. Don't really know much about if or my company's doing anything or if they could be doing better. So from a practical standpoint, what are first steps that I can take to incorporate, as far as it depends on me, right? Health equity into my organization or into my function. Um, any thoughts on that from your
Yeah.
perspective?
So I have two. One is even as an individual, like I mentioned earlier, we can all be individual contributors, right, to health equity. And we can learn more. And as we learn, we can share, right? And that means even sharing within your organization. So I shared that the organization helped with the development of DHEH because I started as an individual, recognized the difference, and then went to one leader after another and just shared what I was learning and got buy-in, right? So as a person in this space in medical and if you're in industry, you can do that, right? Start to learn yourself and share. There are health equity frameworks out there. There are more and more now than before. You can essentially do a quick Google search. I actually did right before we started talking. There's more than I even had seen in the last couple of months. I was talking to a colleague just this week, and he was talking about one he just pulled up. And they're all very similar, and there's
Yeah.
a lot of learning there. So just starting to get an understanding of what health equity means, what these health equity frameworks are, because you can use those to help guide what you do from a health equity perspective. One of the things I did not share, this is my second point. So Google health equity frameworks, share as individuals, and share and learn as individuals. And then the last thing is I'm also a Tequity advisor. I'm one of the first founding Tequity advisors for the health. Remember I mentioned the health conference that was 4,000 people focused on health equity. Now they're about
Yep.
14,000. I love health, by the way. If anybody can get to health, it's like one of the best meetings you'll ever want to go to in life. Um, they spun off and created the Health Foundation that focuses
Okay.
only on health equity. And the woman that leads it is fantastic. Her name is Jana Guiden, and she's very focused on her mission is how can we do exactly what you're asking me? How can we give information to organizations, to individuals who want to do more by way of what we call tequity?
Never heard of the word tequity. That's really cool. Okay. Tell us more.
Please learn more about Tequity. It's essentially providing exactly what we're saying, right? But it's more around the digital space, right? How can
Okay.
we leverage today's access and today's tools to really help bridge the gap in health equity? And we did a survey among 200 people who are either in leadership roles or CEO roles, leaders I think we did like senior director, VP and above, um, in healthcare organizations, some of
Wow.
which like the ones that folks who would be listening to this. And there were a couple key findings. For one, people are really interested. Two, folks are really investing. Um,
Mm.
uh, and so the survey in of itself is insightful. It will share with you what others are doing. But then we took it a step further, and we're also providing guidance. And all of this you can actually find on the Health Foundation's website. It is just maybe even just Googling Health Foundation, which is HLTH, by the way, or just starting with www.hlth.com. I think that's the health website, and just searching there. But the foundation itself provides a lot of information on what you can do as an organization or an individual contributor within an organization for health equity.
Awesome. So I'll definitely drop a link to that in
Yeah, I'll send you the link.
the notes, as well as for DHEH, right? So I want to talk a little bit more. So first, before we go to that, did I hear you right, say that there still is an active survey that someone could take for that to
We
understand
launch every year. Well, we've launched one. I think we did sort of an extension of it, but right now,
Okay.
what's most important for the audience is the findings from the survey.
Okay. Got it. Okay.
Mm-hmm.
All right. Well, maybe even, I
And
don't
I'm
know if
on
we can.
LinkedIn if anyone wants to reach out. happy to,
I,
chat
I
more.
don't know if we could even send, maybe we can even provide the direct link to the survey findings. I don't know if that's a
Yeah, I
potential
can.
or not as well too. So maybe we can do that and put that in the show notes.
And the documents and the resources that we provide, that we're developing, have developed. I can definitely share that with you. I just need to make sure that health gets the credit.
So let's talk a little bit about DHEH, right? So you mentioned frameworks and resources. There's a variety of those, but let's get back into specifics of your organization, and then even potential ways of partnerships. So with that, tell us about the types of resources that can be found at DHEH, and then how to potentially get plugged in.
Yeah, so get plugged in by definitely just reaching out to me directly. I think it's the best way to go at
So
this.
is that on LinkedIn, or is it on DHEH website, or?
So you'll find contact on the DHEH website. The
Okay.
fastest way and to get the most interactive discussion is to just reach out to me on LinkedIn, and I will
Okay.
email or call back or send my contact information or whatever. Because I'd like to also make sure that whoever has an interest gets plugged in to the best of their ability, right? If you want to
Yeah.
contribute in a certain way, folks may want to donate. They might want to donate time. They might just want to get an understanding. And so that's the best way, I think, to contact, and also go to the dhehalliance.org website. I will also give you the link to the website for the organization. And I'll tell you the biggest gap, which we have not done much in 2025. But the biggest gap is just getting people to come along with us when we lobby.
Hmm.
Just representation, just go and speak to your legislators. A simple letter, coming with us, and it's such an eye opener. Like when I first started this organization, one of the things that came up was our legislators didn't necessarily want to pass digital health Medicare coverage of apps that had gamification. And I thought, why? They didn't want to pay for games. But gamification changes behavior, and
Yeah.
the majority of our chronic diseases are driven by behavior. And so it seemed like like a missed opportunity. So we need people to kind of speak more about these kinds of things. We also need the medical community to be more aware of digital health and how effective it could be, and therefore communicate this with your legislators as well.
So one of the things that just came to mind with this is a lot of organizations, farm organizations now have an opportunity to do volunteer day or one of those types of things where you get a
Wow.
chance to step away, right, and do something different.
That's
What a
great.
great opportunity. But some people just don't know what to get plugged into. This could be a great resource, great opportunity to do that. And then, maybe, and not putting you on the spot, Tanisha, by any means, but maybe even, so if I were wanting to talk to my legislator, I mean, is there a template form that could be utilized around the initiatives? Is that something that could be found there, or instructions on how to utilize Copilot? I mean, we can figure out ways to do it, but I think that's the more we can clear the path for people to step in and know exactly what will resonate and what doesn't, I think will be helpful. I don't know if you have anything specific to that. This is just a thought partnership with you on that, if you have not already done that.
Well, you're
But what a
spot
great opportunity.
Yeah, what a great opportunity. You're spot on, and that is definitely something we are working on. And it's not up yet because one reason in particular. It is a member organization when we started it, right? So if you remember, I mentioned that we had, these big community
Yep. Yep.
organizations meet, they have representatives who represent the organization. Well, as time has progressed, so many people are interested in DHEH. And we started to see a huge gap by way of volume. We needed boots on the ground when we were going out as
Yeah.
individuals. And the last time I went, one of the legislators himself walked in and said to me specifically, what are patients really saying? Right? What are the people in my constituency saying? And that was an eye opener for me. That's when I felt like I need more people right? I know we started as a member organization, but we need more individuals who are passionate about this, who can speak to it. And so we had this shift, right? So we're kind of even shifting our own business model,
Yeah.
if it makes
Yeah.
sense. That's why it's
Well,
not,
I'm
because it was
glad
not
you're
individual.
Yeah, I'm glad you're adopting and making those just. What came to mind is, and just being in the rare disease space for, I guess, the past 5 years or so, the voice of the patient, right? That when you're going in, like how what you're talking about in ways is almost bringing that to a local level as well, too,
Yeah.
right? And beyond just for drug evaluation and those types of things and testimonies, it really is how do we bring this to a grassroots type of effort.
Yeah.
And so just needing the tools and do that. Fascinating conversation. I feel encouraged, inspired to do more, Tanisha. Thanks for your work on doing that. So, with that, any parting or closing thoughts as we're wrapping up? A call to action, even if you will, for our listeners today.
Yeah. So one closing thought and one call to action. So the closing thought is essentially what I said earlier. I'm just revisiting that anyone and everyone can contribute
Yeah,
to health equity and trying to make sure that everyone, regardless of you, whether or not you have cognitive disabilities or if you're from a marginalized population, the aged population, it doesn't matter. Everyone needs to have equitable access, the ability for quality care at the end of the day. And we should all essentially, we can't do it alone, right? So we all
yeah,
need to play a role in that. And even the payers, right? Everyone believes that there is a health equity. We need to have health equity considerations. So there's a lot of momentum still. And so the call to action would be to jump in now. If you're not even quite sure yet, your jump in could just be learning more. It could be that simple.
yeah.
And then the next step could be sharing. And then the next step could be, joining DHEH and whatever our efforts are, or finding another outlet. So that's my call to action and parting words.
Tanisha, I love it. I think one of the things, and you're staying true to your old MSL roots, even right when you said that, like you're not even trying to sell DHEH or a specific. You just want people to be involved in whatever way that is. Google search and find something, but
Oh,
um, do something, right? Take one step forward. I think it's a pretty simple call to action, and I appreciate your passion. It exudes. I think if I can summarize, it's health equity is not optional.
right.
It's essential because we're all patients. I remember you saying that, right? We should be looking for our similarities, and not just being biased by what we see from potential differences, right? We need to be able to acknowledge and how do we step into those, but we all have a common bond. Um, and for practicality, from medical leadership, start small. Assess kind of where things are, build diverse advisory boards like you're thinking about clinical trials, integrate equity into trial design wherever possible, and then leverage partnerships, right? DHEH is one, for guidance and best practices, and then just to be able to move things forward. If we really truly want to make an impact, like we say, as those in science, in the medical or in pharma, this is just a great way to be able to do that. So to learn more about DHEH, I think this is right. It's dhehalliance.org. Is that the correct
Okay.
website?
Enough.
Awesome. Awesome. Tanisha, I love that our relationship has extended beyond just when we were colleagues at the same company, but it's continued on for, gosh, I don't even know how long now, 10 years or 10 plus years. It's been a while. My hair may be the same color. Yours has changed over the years. I mean, mine's
Guys.
been white since 30 something on. But anyway, listeners, thanks so much for tuning in to another casual conversation, where leaders learn from leaders. If you've enjoyed this episode, be sure to subscribe, share it with your colleagues. Until then, Remember that leaders don't develop in isolation. Leaders learn from leaders. Until next time, keep driving meaningful change in healthcare in big ways or small. Just keep pushing it forward. See you next time.